Venous disease is a problem that affects upwards of 25 million Americans. It is something that there is no real cause for, but is something that is associated with heredity, the female sex, multiple pregnancies, standing occupations, older age. And basically it refers in general to the lack of valve function in the deep or superficial venous system. And that is something that really can't be diagnosed just by looking at a patient or looking at their legs. It has to be diagnosed by ultrasound. It's not something that limits someone's life, nor does it almost ever cause limb loss, but it is affected with a really reduced quality of life in tens of millions of patients. And it's something where, especially over the last 10 years, we have some really good techniques to help treat that improve patients' quality of life, improve patients' appearance, and can really minimize symptoms. So venous disease, when most people discuss it, refer to venous reflux or venous insufficiency. And what that means is that the valves that help veins return blood to the heart, because that's the job of the veins, don't function properly. Usually valves open to let the blood go up and then close to prevent the blood from pooling back in the legs because of gravity. In patients with venous disease, the valves don't function properly, they stay open, and then the blood pools in people's legs. Again, most of the people that we see with venous disease fit a certain demographic. Most of them are female, they're between the ages of 35 and 55, they've had multiple pregnancies. We see a lot of teachers, stewardesses, hairdressers, people in retail, because standing on your legs for hours on end isn't very good for the valves. It's increased in people as they age. In fact, there's some reports out there that over 60% of women over the age of 65 have some kind of venous insufficiency. But there's no real cause of venous disease per se.